would I find 22 billion?
Where would I find those savings?
22 billion pounds of savings.
Go on. It's such a massive, massive task, but actually I really don't even know.
Lots and lots of managers, possibly we could look at cutting some of them.
I would find those savings in the sort of bureaucracy. It seems to me, from where I stand, that there's an awful lot of people telling not very many people what to do.
Managers are quite crucial to the NHS, and it's always an easy target from press and politicians.
Multi-million-pound businesses, really complex organisations require some very strong management.
The truth is we need really good managers, because good managers ensure that you get really good outcomes for patients.
Hospital beds every night for people who could just be being looked after at home, surely there's quite a bit of savings to be done there.
The first thing that needs to happen is a substantial shift from specialist acute services into primary care.
Patients that are in beds don't necessarily need to be there. They could be sent back to the community and be more comfortable at home receiving the care that they need.
What we tend to do is to try and reduce the resource in hospital, and then miraculously think something's going to happen in the community. Well, of course, there hasn't been any significant investment in community services. So if we do take the money out, then actually we end up getting stuck.
If we take a service like the police, crime has fallen very significantly over the last 5 years, and there are fewer police officers delivering that improved service. And the health service, I think, has lagged behind those changes.
That flies in the face of the rest of the world. We have fewer doctors per head in the UK than virtually all other European countries. So we're not starting from an inflated workforce. We're starting from a position of having fewer doctors per head and actually spending far less than other comparative countries.
There's never enough, and we know that there's some real pressure on clinical staff. So I would say that is absolutely impossible, and in fact we should be investing in those clinical staff that make a difference.
We don't spend as much on it as some other countries do.
Rich people should be taxed more in order for the NHS to function as it does now.
The UK health service has never had more resources. It's coming out of a period of very, very high spending increases. Its challenge is a productivity one.
I certainly think that whichever way we look at it, the government is going to have to fund the NHS at a level that is comparable to other Western nations. I think we're trying to do the impossible at the moment in spending less but expecting to do more.